Hello everyone, I am Divya. It is a great opportunity for me to be here amongst a wonderful audience to talk about a priority health issue that happened in my family. My grandmother was diagnosed with a benign cyst that had the potential to grow slowly into a cancerous tumor of bowel. It was shocking and prompted me to do some research into different type of cancers that could affect me in Australia in the future. In this video, I will be going to talk about bowel cancer and the health promotion initiatives of this important health issue. Life is too much fun to miss, so let's get started. Most deaths in Australia fall into five broad categories. These are circulatory diseases, cancers, respiratory diseases, infectious diseases, injury, and poisoning. Cancer has been one of the leading causes of death. Let's know more about what is cancer. Our body is made up of cells that make up tissues and organs. Cancer is a disease of the body cells. The body constantly makes new cells to help us grow. Normally, cells multiply and die in an orderly way so that each new cell replaces one lost. However, sometimes cells become abnormal and keep growing. These abnormal cells may turn into cancer. They may invade nearby tissue, destroying normal cells to form malignant tumors. By age of 85, 1 in 2 people will develop cancer and 1 in 5 people will die from cancer. Top 5 commonly diagnosed cancers are prostate cancer in men, breast cancer in women, colorectal cancer also known as bowel cancer, skin cancer, and lung cancer. Bowel cancer is the fourth leading cause of death in Australia for people in age groups 45 to 64 and 65 to 74 years. Hence, population aged from 50 to 74 years is my target population group. Bowel is a part of the lower gastrointestinal tract, which is a part of the digestive system. Bowel cancer is a cancer of the large intestine. Abnormal cells growing and multiplying out of control in the colon or rectum. It is sometimes known as colorectal cancer, also known as colon cancer or rectal cancer, depending on where it occurs in the bowel. Colorectal cancer can arise from polyps, small benign growths in the wall of the colon. It generally develops through a multi-stage process in which a series of cellular mutations occur over time. Polyps may undergo further mutations and become a malignant bowel cancer. Polyps are relatively common in older age, but it can occur at any age as they develop in 5 to 15 years over time. So, treating bowel cancer as soon as it is discovered is very important. In Australia, the 5-year survival rate of people with localized stage bowel cancer is 90%. If the cancer has spread to surrounding tissues or organs to regional lymph nodes, the 5-year survival rate drops to 71%. Bowel cancer is most common in people over 50, but it can occur at any age. Bowel cancer in most cases has no symptoms. Some people do have some symptoms like a visible rectal bleeding, a change in bowel habits such as diarrhea, constipation, bowel obstruction, losing weight, rectal or anal pain, a lump in the rectum or anus, abdominal pain or swelling. Iron deficiency is an early sign of bowel cancer. There are some risk factors that would increase the chances of having bowel cancer, like older age, most commonly in people over 50 years, having a large number of polyps in the bowel, lifestyle factors like being overweight, physical inactivity, having a diet high in red meat, drinking alcohol, and smoking. Around 30% of bowel cancer cases diagnosed have a strong family history. Rare genetic disorders like FAP and Lynch syndrome, where faulty genes are inherited, causes 5 to 6% of bowel cancers. Modifiable lifestyle protective factors can reduce your risk of developing bowel cancer. Limit the amount of alcohol. Risk of developing cancer increases when 2 or more alcoholic drinks are consumed per day. Taking aspirin decreases the risk of developing bowel cancer. Control body fatness. Increase intake of dairy products and calcium supplements like low-fat milk, yogurt, and cheese in your daily diet. Physical activity can reduce colon cancer by 16%. Reduce eating red meat. Quit smoking and avoid exposure to tobacco smoke. Consuming fruits, vegetables, whole grains, and foods containing dietary fiber decreases the risk. National Bowel Cancer Screening Program invites people from 50 to 74 years of age to screen for bowel cancer using a free, simple test at home. Eligible Australians will receive a free bowel cancer screening home test kit in the mail. You can contact the National Program Helpline at 1 800 930 998 to find out how the program works and for any help in doing the bowel cancer screening test. According to Cancer Institute NSW, bowel cancer currently kills more people in NSW than prostate cancer, breast cancer, or skin cancer. Currently, only 36% of the eligible people in NSW take part in the National Bowel Cancer Screening Program, much lower than screening for breast cancer or cervical cancer. Many non-government organizations are promoting screening, diagnosis, and supporting treatment of bowel cancer. And you can help out by donating to these bowel cancer charities such as Cancer Council Australia, Rotary Bowel Scan, Let's Beat Bowel Cancer, and also Bowel Cancer Australia. You would have seen these charities over social marketing media like telly, billboards, bus stops, radio, digital advertising. Bowel Cancer Australia is a community funded national charity. BCA has launched multiple initiatives and campaigns throughout Australia. Initiatives like Bowel Care Nurses Program and Bowel Care Nutritionist Program provide telenursing support nationwide through friendly nurses and nutritionists. BCA's peer-to-peer support network program connects cancer patients and loved ones on a one-to-one buddy basis to exchange advice and experiences. Bowel Screen Australia program of BCA nationally provides greater access for screening through community pharmacies. In Port Macquarie, the Gut Foundation, in conjunction with the University of NSW Rural Clinical School, has been running an innovative bowel cancer screening initiative designed to save lives. People with lack of education about the disease are at higher risk. Education is empowerment. Education allows individuals to make better decisions about determinants of health and health behaviors. Developing personal skills, education via media, and creating awareness amongst the people is very essential. June is the Bowel Cancer Awareness Month for raising awareness of bowel cancer in Australia. During this month, promotional activities are conducted to promote and encourage people who are at high risk of developing the disease or experiencing symptoms to see a doctor and get checked. People without symptoms are encouraged to talk to their GPs and take advantage of a bowel screening test for bowel cancer prevention and early detection. Red Apple Day on 16 June 2021 is Annual Giving Day when Australians are encouraged to support the vital work of the charity. Such awareness campaigns and initiatives on television, social media, and other online platforms are having a positive influence on people and are changing their attitude towards bowel cancer and help beat it. You are empowered by what you know, and that is my goal today, to teach my audience about bowel cancer health awareness. I urge you to learn about this disease like I have. Be familiar with your body and know your symptoms. I encourage all Australians above 50 years of age, including Aboriginal and Torres Strait Islander, not to delay and do a bowel screen test today and participate in the National Bowel Cancer Screening Program. Enroll for National Screening Program. Your health matters the most. Educate to empower yourself and people around you. Life is too much fun to miss. Thank you for watching.